Hello, I'm Senator Gary Peters, and it is an honor to join and welcome you to the March of Dimes Signature Chefs Auction as we celebrate the 12th anniversary of this spectacular culinary event. Through your support and generosity, the March of Dimes is able to continue improving the odds for every infant born in Michigan and across our country. Every contribution allows March of Dimes to combat birth defects and devastating childhood diseases with cutting-edge research, community service, and educational programs. Right here in Ann Arbor, researchers at the University of Michigan and the University of Michigan Medical School received over $1.4 million in March of Dimes grants to help find the cures to serious problems that threaten our babies. This incredible success was achieved thanks in large part to the tremendous hard work of Linda Learman, chairwoman of this event, as well as many committee members and volunteers who have made this event and this year special. None of the March of Dimes work to support moms, babies, and families would have been possible without the commitment and generosity of people like you. As you greet old friends and make new ones during the course of the night, I ask you to reflect on your theme, a fighting chance for every baby. I can think of no person who embodies this theme more than your 2016 honoree, Dr. Neal Weinberg, a committed pediatrician who has been caring for children and their families for over 40 years. Neal has continued his advocacy for Michigan families through his service as the president of the Michigan chapter of the American Academy of Pediatrics. As president, he has played a special role in ensuring the children of Flint have the resources and support they need to battle the cognitive, behavioral, and health challenges resulting from lead poisoning. His efforts will improve the health and well-being of these kids who have suffered so much. And on a personal note, in addition to being the father of my legislative director, Neal has also served as my de facto personal photographer, capturing several special moments throughout my career in public service. I thank him for his friendship and his leadership, and it is a great privilege to join in recognizing him for his passion and his dedication this evening. And in closing, we have all benefited from March of Dimes research, education, vaccines, and breakthroughs. March of Dimes' 76 years of leadership has ensured that we are all March of Dime babies. Again, thank you for attending this evening and for celebrating all babies, those born healthy and those who need our help to survive and thrive.
For me, it was a combination of what I really liked in medical school and sort of my idealism and interest in prevention. I had mentors in pediatrics that I really liked. I liked the people in pediatrics. I liked working with kids. And I really enjoyed taking care of the really sick babies. You know, we'd do an intervention in the delivery room or right after, and we could make things happen quickly, and the kids got better. The interest that March of Dimes has in pregnant moms, preventing prematurity, birth defects, the work they've done with immunizations. These are huge, because if you can reduce the morbidity and mortality, you're going to have healthier kids, you're going to have much lower disease burden in the community. So there's a lot of really palpable things that the March of Dimes, I think, contributes to. Our practice here, in particular, 25% of our population is Medicaid. And they have very unique needs. 25% of the kids in the state, over 500,000 kids, are born into poverty. Their medical issues are severely compromised by sociological issues. Do they have shelter? Do they have food? Or what we call the number of toxic stresses in their life? We have an opportunity to impact that. So being able to work with these kids and the families and help them through their issues, at least a little bit, kind of keeps us coming back. We have two boys. David is the oldest. Michigan grad, went to law school in Boston, and joined Gary Peters' staff right out of law school. He worked on that election, and now he's Senator Peters' legislative director. And Stephen, in his work, actually in his work leading up to medical school, got quite involved in global health, which he continued throughout medical school, and kind of pulled me into some of that. Maybe I'll walk out of here in 4 years, he'll walk in here, and we'll just keep going.
name's Stephen Weinberg, the very proud son of Neal Weinberg, and this is my wife, Kate.
We wish we could be with you tonight, but we're joining you from our new home at the University of North Carolina, where I'm completing a residency in obstetrics and gynecology, and he's training in pediatrics.
This apple certainly didn't fall far from the tree. Over the 29 years that I've been around, which is only part of my dad's 45 years in practice, I've always admired how he's worked tirelessly day in and day out for children and their families. He, throughout his career, has always exemplified what it means to be a pediatrician, trying to set the foundation and put kids on the right path.
Neal has demonstrated for us and so many other doctors that a physician's role extends beyond the hospital and clinic walls. In the way that he advocates for policy for children and leads programs that will better children's lives is truly inspirational.
Being at such an early point in our careers, for which we'll be helping women and children throughout the rest of our time as physicians, it's been a special experience in being able to have my own dad as a role model. So congratulations, Dad, and please join us in welcoming Dr. Neal Weinberg.